I'm already a quick speaker, so I'm even going to be quicker. One, general public health work program. If you believe, as you said earlier, that measles is something that should be taken care of, right? And we're talking, it is a communicable disease, is it not? Then why would you go about cutting $27 million from general public health work programs that do, among other things, acute communicable disease outbreak, STD, HIV screenings, naloxone distribution? Tell me quickly, why is that something that makes sense?
Like
For the city of New York.
Well, for the city of New York, as I mentioned before, they can get resources from other areas, and so we're just trying to...
That's an assumption that you're making, which is great, but that doesn't mean that they're actually going to get it. They can apply, but that doesn't mean they're going to get it. And also, there's a hit that's actually 2 years, because their fiscal is different than ours, so their cut is not 26, it's actually like 50-something.
We looked at it. I think it's the same year. We looked into that.
I just got information from the city today that says 2 million. This is how quickly I'm going to go, just so you know. So that one is a problem, thumbs down. Second, when we're talking about fiscal intermediaries, we talked about it,
Right.
and a couple of my colleagues are probably going to do the same thing. If you truly believe that consumer-directed programs not only save money, because they do, and it actually provides for disabled individuals to be able to live a fuller life. Have you thought about how much the changes that you're proposing might impact the program in a way that might actually dislodge some of these folks that are, without this program, they would not be able to actually live full lives?
We'll look at, yeah.
That you have to, okay. I'm thankful, however, that we didn't have to, I'm not sure why y'all keep doing prescribed prevail, spousal support. We do it every year. Thanks, but no thanks. Just want to know that I'm not sure why it's in there, but just so y'all know. I'm concerned about managed long-term care plans. Particularly, we've talked
Right.
a lot about ICS in particular. Gildan also went out of business, which certainly there has to be a concern about a high-need rate cell. We've talked about it a long time. I think it is absolutely necessary. Without these type of rate cells, the idea that long-term care plans would be able to continue to exist, they're necessary as insurance plans, managed long-term care plans, but they're just going out of business, left and right, because they have to take care of the needs are so high. So a high-need rate cell is something I'd like you to consider. I'd also, on the emergency transportation stuff, a lot of my colleagues have also spoken about that, and I would just add that much like when we talked about the CDPAP, the fiscal intermediary, or the issue of the case mix, please think through how this is actually going to impact people that are currently receiving the services. We all understand that we need to save money, we get it, but as in Spanish, there's this thing when I was in Puerto Rico, lo barato sale caro. The cheap things sometimes are very expensive at the end of the day, like how do you, not spending the money, not investing the money up front might actually have an impact, a negative impact. Second, this I do want you to respond to. The Fidelis and Team thing we talked about earlier, but I've been around here long enough to know that press releases don't really mean anything. So I want to know in what document. You told us you did the breakdown of the percentage of how that's going to break down, which is going to go to nursing homes and hospitals, et cetera. Could you tell me where that is in an actual document, like a budget document or like something like that?
We will get that for you, for when it was in the state register.
Oh, wait, so
But-
there's, okay.
Yep. Yeah, and there'll be a state plan amendment
Gotcha.
as well for it.
Something
Right.
that's like a
Yes.
hard thing. Okay, thank you. And I know there was also and last, and I know that probably Member Godfrey will add on to this as well. As far as the Access Commission, the commission, we talked about it briefly. I could certainly ask you questions about how exactly it's organized, et cetera, and who are the people that are going to be on it, and what have you. But it seems to me that it seems certainly to Member Godfrey and myself that it is not, that for the record, it is not a really productive thing. We don't know exactly who's going to be in there. There's no breakdown as far as whether there's going to be representatives that can be appointed by the legislature, folks that are representative of patients. It seems to us like it's just something that you want to put forward so you can say that you're kind of doing something about it and thinking about it, but not really. So just for the record, not a fan. So yeah. And last but not least, on the essential plan expansion, I know there's been conversations about it. I'd certainly the budget impact, the shortfall that was announced again magically yesterday, where all of a sudden we have $2.5 million or whatever it is that we didn't know we were not going to have. obviously it impacts everything, and so it impact that, but just as a 5-second thing, certainly consider how we're going to expand the essential plan to cover people who are not currently covered. I tried to do the best.